Today's moderator is Jan Lesher, and a brand new league member. Jan is Chief Deputy Pima County Administrator. Jan has an impressive resume, which includes her work as Chief of Staff for former Governor Janet Napolitano. She also served as Chief of Staff for Operations, Department of Homeland Security, under Secretary Janet Napolitano. Jan will introduce our distinguished panel. Thank you so much.
Thank you so much, and good morning. I am honored to be a returning league member. It's been a lot of years, but I'm back, and thank you so much. I, like all of you, so admire the work of the league, and thanks for what you do every single day in addition to these wonderful breakfasts. I was thrilled to be part of today's panel about aging. Obviously not your issue. If it's not, it certainly soon will be. I think for many of us, aging was something that we knew we needed to be aware of as it dealt with grandparents or parents and others around us, and it seems that every single day we realize it is an issue that is more important to each and every one of us. At the county, I see it as we deal with workforce issues, we deal with it with our family members, and I realize as we all get older that how we choose to age, what will be the impact on us as we age, and what our end-of-life issues look like are things that we as an individual need to think more about all the time, but then realize that they are issues about which we need to make sure that those around us are aware of our wishes, because what happens if something were to occur to us and we're no longer able to articulate our wishes, and who around us is aware of those issues, and then what legally do we need to do to get those in place, because it's a complicated world and it's more complicated as we age. And as we begin that process towards the end of life. So I'm thrilled to have a really terrific panel, and as we mentioned, please write down your questions. They will be picked up, and we'll collect those at the end and make sure that we leave plenty of time for people to have some conversation. So with that, let's get on with the panel. I'm going to take a moment and introduce these three terrific ladies. We are blessed to have an extraordinary panel today of some of the greatest experts in this community, and I, like you, look forward to hearing from them. So I'm going to introduce them all right now, and then we'll open up with questions. There was a day I didn't need these, but we all know what that's about. As the reading glasses do come on. First of all, let me introduce Dr. Mindy Fain. Mindy joined the U of A medical faculty in 1985 and has made truly a remarkable difference in the availability and quality of healthcare in Arizona, especially among the elderly. She is the co-director of the Arizona Center on Aging, is chief of the Division of Geriatrics, General Internal Medicine, and Palliative Medicine at the U of A College of Medicine. For 25 years, she was medical director of the Southern Arizona VA healthcare system home-based primary care. Dr. Fain received recognition from local, state, national medical communities, and her MD degree is from New York University. Mindy, welcome. Thank you. Lisa Reams. Lisa is the Vice President of Programs and Services at Pima Council on Aging. Lisa co-chairs the Behavioral Health and Aging Council and is on the Arizona Attorney General's Office Task Force Against Senior Abuse. She also works with many local animal rescue groups and holds an MS and BS degrees from Capella University and the University of Arizona. Good morning, Lisa. Sara Ascher. Sara is an advocate for person-centered quality of life and is the senior director at the Arizona End-of-Life Center Partnership for the United Way of Tucson in Southern Arizona. Sara's passion is rooted in 30-plus years of healthcare work and family experience with cancer, depression, and dementia. Building evidence-based, innovative programs and nurturing relationships with people define her work. With Cedrum Medicine and Banner University Medicine, University Medical Center, and Carondelet. She holds MS and BS degrees from the University of Arizona. Sara, good morning to you as well. Thank you. As you can see, it's a terrific panel. We look forward to So to kick this off, Mindy, I'm going to start with you. We hear about social determinants of health, SDOH, and what those determinants are having a major impact on all of us and on aging. What does that mean?
Well, thank you for asking that, and I'm just really delighted to be here. And so I'll start off by saying that the social determinants of health are those factors that really greatly impact on our overall health and well-being, but are traditionally considered non-medical. When they're kind of the conditions that we are born into, that we grow up in, that we live and work in, and we age and die in. And I'll get a little more specific in a moment, but that's sort of like the overall understanding of what they are. When I first became in my medical school training as an early physician, I really mistakenly believed that most of a person's health was related to kind of the primary care providers that they were seeing, maybe the specialists, maybe the medicines that they were taking, with a little bit of understanding of the role of exercise and nutrition. This was many years ago. I think our training is different now, but that was the understanding, the mistaken understanding that I had and a lot of people still hold. And so I just wanted to emphasize the importance of these social determinants of health. If we look at overall health, about 20% is genetic. About 20% is the stuff that traditional healthcare does, and about 60% are these social determinants of health. So hopefully that kind of frames it as we talk a little bit more about the specifics. These conditions, and they vary across people, families, cities, towns, countries, nations. So they're very personal and they're very global at the same time. And certainly for an organization like this, you can understand the impact on both the personal and the national level. So just to kind of dig in a little bit more, I'll list them a little bit and then kind of tie them into aging. One of the main areas has to do with socioeconomic status and how that determines so many things in our lives. And we know that so many older people live in poverty, despite what younger people may feel about the impact of Social Security and Medicare and so on. The education, health literacy is a big piece. Stress, whether it be brief or longitudinal, and stress is cumulative. Certainly caregiving is an important source of both a sense of connection to others, but also can be a source of stress. Mental health issues, and again with older adults, that can include things like cognitive impairment and dementia. We know depression is just as common in younger people as older, but again, depression is important. Social isolation and loneliness, and we've heard a lot about that, and we'll hear more about that. Housing stability, feeling comfortable, safe, that one has a roof over their head is huge, and food insecurity. Social exclusion or support that ties into loneliness, and again, ageism, discrimination at all levels. We can see where these things fold into. The way to sort of, and again, it's just a large overview, ageism is a huge piece of it. And so I'm delighted to be part of this panel where we're really going to talk about how one then impacts on these social determinants of health. And so I'll pause here.
And very helpful. Thank you so much. Lisa, there are programs, there are program areas that Pima Council on Aging supports and can help people in the community, and I know they address some of the topics that Mindy has just delineated. I wonder if you can take a little bit of time and tell us more about those programs and what occurs.
Absolutely, Jan, thank you. And thank you for inviting me here today. I first became involved with the League of Women Voters when I facilitated that running and winning event a couple of years ago, and that was a very exciting opportunity for me to learn all about the informative programs that you provide for the community, so thank you. Pima Council on Aging, PCOA, has a number of programs that assist older adults with social determinants of health. And first, I'd really like to stress that anytime you seek information on a resource for aging, please call PCOA's helpline. Or you can email us at help@pcoa.org. And we have a number of helpline specialists that are available to answer all of your questions. We're the place to go for help when you don't know where to start or not even sure what questions to ask. So we really invite everyone to take advantage of that resource. We also maintain a database of over 2,000 resources in the community for older adults. And we're always keeping that up to date, and we've been in the process of transitioning that to an online searchable database through our website. So if you go to PCOA's website, you can actually search for a number of different resources, whether that's related to food or housing or transportation, and you can sort and print lists from there. So I encourage you, if you haven't been to our website recently, to check that out, and it can really be a great resource. With the over 60 population in Pima County growing at a rate of over 17% a year compared to a population growth in the county of only 3%, these resources are becoming more important than ever. And I want to talk about 3 different categories of resources for a minute related to social determinants of health. One is access to adequate nutrition. One is social connectedness to combat loneliness and isolation. And one is supports to live at home and outside of institutionalized care. PCOA has services to help with all of these areas, and there are 3 very key areas that affect older adults in our community. Related to adequate nutrition, you can imagine how difficult it might be as you get older to be able to either shop for food, perhaps with mobility or transportation issues. Being able to afford food is an issue for some older adults, and then having the physical ability to prepare food. And adequate nutrition is, of course, directly correlated with a number of health areas, such as doctor's visits, length of hospital stays, and longevity. In fact, the Centers for Medicare and Medicaid Services have submitted a proposal to allow Medicare Advantage plans to contract with Meals on Wheels programs because they're recognizing the importance of food and nutrition to people's health. So if you call PCOA, we can actually link you with home-delivered meals. Some of the home-delivered meals providers even deliver pet food. That's an issue for a lot of older adults. There are 13 senior lunch programs in the greater Tucson area, and there's also grocery shopping services if people can actually still prepare their own food but just can't really get out to get that food. Next, moving on to social connectedness to combat loneliness and isolation. So nearly half of older adults over the age of 75 live alone. That's surprising for a lot of folks. And social isolation has been shown to have the equivalent impact on older adults of smoking 15 to 20 cigarettes a day. That's how much of an impact it has on people's health. So there are a number of ways in the community that people can connect with each other, and PCOA can help with those things. Our senior lunch programs are offered throughout the community, and they also provide an avenue for social connectedness. Senior centers offer a variety of accessible activities, and yet we find that senior centers are only accessed by about 2% of the eligible population. Transportation to services is quite a challenge, but there's a lot of options, from using Sunvan to accessing a network of volunteer programs through our Neighbors Care Alliance. There may be a volunteer program in your area that can provide companionship and transportation for older adults. And PCOA also has a senior companion program, and that is a program that allows low-income senior volunteers to pair up with homebound older adults for companionship and transportation. The last thing I'd like to talk about is supports to live at home and out of institutionalized care. So 85% of older adults express a desire to live in their home as long as they possibly can. I'm sure many of you can relate to that desire. And aging in place at home is correlated with greater physical and mental health, happiness, and longevity. But there's a lot of challenges to live in your home as long as possible. So the number one issue, the number one concern mentioned by older adults whenever we do a community-wide survey is fear of falling. And the older one gets, the more of an issue this becomes. So PCOA participates on the Arizona Falls Prevention Coalition, where we educate and prepare older adults to prevent falls. And we can assist with things like home modifications to help your home be safer and more accessible as you get older. Installation of things like ramps or grab bars, or just devices like raised toilet seats, shower chairs, things like that. We also offer evidence-based falls prevention classes in community locations. Providing in-home supports to older adults as they get older, and they're not able to do as many activities of daily living all on their own as they used to be able to do, such as housekeeping, personal care, bathing, grooming, things like this are really important. And there are a lot of businesses that provide paid caregivers who can come into the home and help with these things. Some older adults have challenges affording that, and I'll be honest with you, there's not enough paid caregivers to go around. And as our population is aging and not as many people are getting into the field of caregiving, that's something that's going to become more and more an issue in our community. In fact, within the next 15 years, the number of Americans over age 65 will surpass those under the age of 18 for the first time in history. So this is a very real issue that people are needing more supports than ever. There's more people needing supports than not necessarily enough folks to support them. So one of the things we find as a result of that is that families are having to really step up and be informal caregivers for their loved ones. And this is great and is incredibly helpful for loved ones to remain out of institutionalized care as long as possible. But you can imagine the stress that places on family caregivers who are also trying to go to school or working or have other stresses and responsibilities in their lives. So PCOA offers a number of services to support family caregivers through training, respite care, which allows them to get away for a few hours a week and take care of things they need to do outside of the home. And we also have 11 support groups throughout the community for family caregivers. So I'll stop there for the moment.
I'm going to ask you to go a little bit more on one other topic, if you can. Another issue that I think as people age becomes more and more confusing is that of Medicare. Does Pima Council on Aging provide help and direction and assistance as people begin to navigate that system?
Absolutely. Thanks for asking. So we offer a 3-hour Understanding Medicare presentation. We do this twice a month at 2 different libraries in town, the Murphy-Wilmot Library and the Woods Memorial Library on First Avenue. There's no cost. There's no need to register. You can find the schedule through our website. And so you just show up and take advantage of these presentations, and there's a lot of time to ask questions and get the information you need. During open enrollment for Medicare, which is mid-October through early December, we also offer several free open enrollment presentations in various community locations. And this can provide you with the most up-to-date information on what's happened this year related to Medicare. This past year, there were actually a number of changes, and we wanted to make sure everyone had the information to make good decisions for them. We also offer trained staff and volunteer Medicare counselors, and these folks can sit down one-on-one with each of you and really help you understand, looking at your unique situation, your health conditions, the medications you're on, what your interests are. They can really help you select the plans and the options that are going to work best for you. They can help you understand Medicare Parts A, B, C, and D, and what the best plan is for you, how to enroll, what penalties might be involved if you don't enroll right away. And we can help with how to appeal if you've had a charge be denied and you're wanting to look into how you work with that. Our Medicare counselors are neutral. They're not affiliated with any insurance plan, which is really important because we can help save Southern Arizonans hundreds of thousands of dollars a year by making good decisions. I just heard of a story where we had somebody that between the premiums they were paying and the amount of money they were having to spend in the donut hole, that their medical care was costing them $10,000 a year. And by working with our Medicare counselors and looking at different plans and options and really what their specific needs were, we were able to get that down to $2,500 a year for them. So it's really important that you take advantage of that resource.
Wonderful, thank you. Thank you so much. I want to talk a little bit now about the real impacts of caregiving and how it's impacted so many of us, and turn to Sara a moment. I think Sara's had an experience, as so many of you may have had, being at work, taking care of people in the healthcare field when she got a call, as I understand, about your own family situation and what that meant to you to then be caught between your work and taking care of of a father, I believe, and then what that life looked like. So if you please share that.
Thank you, Jan. Can everyone hear me okay? I'm realizing that short people like me have issues with microphones even when we're sitting down. So I'd like to, yes, tell you a story. My father was diagnosed with dementia in his early 70s. And I was living in Arizona, Tucson, and had been for many years at that point. And I moved him from his home in New Orleans to Tucson and became his caregiver and legal guardian for 7 years until his death. At that time, I was working here at a local hospital in a leadership position for an outpatient neurologic rehabilitation program. And I was at work one day, and I got a call from another hospital in town where my dad had been admitted a few days prior to that, subsequent to a fall and related injuries. And the woman on the other end of the line said, "I have great news for you. Your dad's getting discharged." And I said, "Oh, that's great. When?" And she said, "Right now, in the next couple of hours." And I said, "Well, I'm at work and I'm preparing for a meeting right now, and then I have to, after work, pick up my kids from aftercare, from school aftercare." And she said, "Well, I'm sorry, but you're going to have to figure it out because we're discharging him and you have to be here." So I went to the hospital and I signed the discharge papers, and at that point realized that my dad needed to be changed. He was incontinent. And I asked the staff if they could help me get him changed, and I said, "Well, technically he's been discharged, so we can't help you." And I want to say that this problem, these issues that I'm talking about are not specific to any one hospital. I think they're really across our healthcare system. So I had to get very assertive and use my knowledge from working in healthcare to get people to assist me, which finally did happen. I got him out to my car, and I, at the time, had a little Suzuki SUV, and tried to get him into my car, and there was about a 6-inch step up, and realized I couldn't get him into the car. He couldn't lift his leg that high without excruciating pain from his fall injuries. So we went back into the hospital, and I said, "I can't get him into my car. I need help. I'm going to have to find another way to transport him back to his adult care home." And it took several hours and many dollars. It was very expensive to find him transportation back to his care home. And really, that was the first day. It was really an aha moment for me, and the first of many challenges over the course of 7 years. But it was a real aha moment for me, kind of an epiphany, realizing two things. One, that if a person like me who had worked in healthcare for, at that point, more than 20 years, couldn't navigate this system, I couldn't imagine how anyone else could navigate. I had many resources, lots of support, and I was completely lost on the other side. And the second big aha was that our healthcare system is really system-centric rather than person, family, and caregiver-centric. That really it had been designed in the past to meet the needs of the organizations themselves, and lots of assumptions were being made about what people needed and what their families and caregivers needed. So the good news is that things have evolved, and that experience was, my dad died 12 years ago. There's been lots of progress made since then, and the caregiving experience actually led me to work in patient experience, and there's actually whole departments now called patient experience departments in hospitals and healthcare systems that are focusing on patient-centered care. So there has been progress, and I think Mindy could talk a little bit about the progress that's been made over the years in terms of caregiver workforce development and support for caregivers.
Thank you for that. I think we tend to think of a health system as being designed, but I think most of us know it really wasn't designed. It just kind of happened, and so you kind of elevated a little bit. But thank you for that. I think we can talk about this in a couple of different ways. And there's an initiative going on really nationally that a number of the health systems in this town are involved in, which is called the Age-Friendly Health System. I just want to sort of get that idea out. It was the Institute of Healthcare Improvement and the John A. Hartford Foundation that really spread this word that supports what you're saying, which is health systems really aren't set up to support aging and older folks that find themselves within both the ambulatory, inpatient, wherever they see them. And so just be aware of that. And again, I would say every health system in this city, is involved in moving in that direction. And so hopefully we can encourage that. When it comes to caregivers, we've talked about how much we rely on caregivers without necessarily, preparing them, training them, and there are a number of organizations that are involved in that. So one of the issues is that caregivers they suffer health problems. I was a caregiver too for my dad and mom for probably about 20 years. And you do tend to ignore your own health. There are a litany of things that happen to people who are primary caregivers. And a lot of people don't self-identify as caregivers. They just do it. And that's probably the majority that do it. And in the health system, we don't recognize them. So in a number of places, there's initiative really across the country, and hopefully when you see a healthcare provider, they will ask you, in addition to all the other questions, are you a caregiver? And so there's two messages in this. One is if you are a caregiver, recognize that, and then hopefully you will be empowered and help to take better care of yourself. The other arm of it is the education and training. And so we talk about both empowering patients, families, and so on, and educating the healthcare workforce in order to be prepared to take care of older adults. And so that's, I think, what you're referring to a little bit. We have at the Arizona statewide Arizona Geriatric Workforce Enhancement Program grant, again statewide, that is dedicated to preparing both healthcare professionals, providers, in how best to care for older adults. And we also work with families, caregivers, CNAs, DCs, a number of people in this room that we are connected with. It's really a community effort. We're honored to sort of help lead some of this, but there are a number of efforts going on so that if you do find yourself in the need of a medical assistant, a CNA, a home aide, an emergency room physician, that they'd all be prepared to know how best to care for you, us, me, as we age, and loved ones that are aging with us. So I'll stop there.
And Sara, I want to turn back to you for a moment to talk about another community initiative. I think another conversation that is growing all the time is the conversation of the end of life and policies and what the world looks like now as we are aging, and as I'm hearing astonishing numbers about the growth of the aging population. Can you talk a little bit about the community initiative and what's occurring in that realm?
Sure. And I want to start by saying that our mission in the Arizona End of Life Care Partnership is to fundamentally change the way we talk about death. And that's important for some really basic reasons. First and foremost, that aside from birth, it's really the one experience that we quite literally all have in common across the earth. And these days there's such an emphasis on data and outcomes. And what's interesting is people don't talk about the fact that the prevalence data line for death remains steady at 100%, year after year after year. And what the research and surveys tell us is that the number one thing overall that's most important to people who are dying, whether it's kids or adults, is to not be a burden to others. Number one concern. And the best way to do that is to talk to each other, to talk to the people we love, and to talk to our healthcare providers about what we want at the end of life. Do we want treatment up until the last moment? Some people do, but most people really are most focused on quality of life at the end of life. I want to go to the beach, so that's where I want to be, just for the record. My mom died at the age of 51 when I was 15 years old, and that was 40 plus years ago. And she was really ahead of her time in letting people know that she wanted to die at home. In the back room of our house, where she could see the giant oak tree in our backyard. And we had conversations every single day during that process. And I have to tell you that completely shaped my life and continues to shape my life every single day. I'm so grateful that she was able to die in the way she wanted to die, and that talking about that experience and sharing it has enriched my life every single day. It's given me a sense of gratitude that I might not have had otherwise. So talking about death actually enriches our lives and is healthy for us. We're very lucky here in Tucson for lots and lots of reasons. But one of the reasons we're really lucky is that thanks to the David and Laura Lovell Foundation and Community Foundation of Southern Arizona, our community, 10 organizations, received a total of almost $3 million to create an end-of-life care partnership right here in Tucson. We are creating a model for end-of-life care right here. United Way of Tucson and Southern Arizona was named the backbone organization or the anchor organization for this partnership due to its strengths in convening people, ideas, and organizations. We're bringing people together to create a hub of all things related to end-of-life care, a hub of resources, increasing visibility of those resources, helping people navigate. We're really focused on 6 pillars, major pillars: community outreach, community education, so that people have the tools that they need to have these basic conversations, provider education, so that healthcare providers, doctors, nurses, and others have the tools that they need to have these conversations that are difficult for people to have. We are focused on facility-based initiatives, so that we're working with people who are employed and changing things in the workforce, and workforce development, and then policy and advocacy. We really want to invite all of you to join our partnership, individuals and organizations, and particularly, especially organizations involved in any part of that continuum of care, that journey from caregiving and healthcare to planning and grief work. So we invite you all. www.azendoflifecare.org. We want you to join us and join our action teams.
Thank you. And again, a reminder, I believe people are picking up cards because there will be then coming to the audience and asking other questions of our panelists. It is amazing when I listen to this and think about just the importance of the conversation. And I'm sure like many of you, not all of you in the room, I look around and think there are people in the room with whom I've known for 50 years at least. And the conversations we used to have about marriage or children and qualities of daycare and all of those conversations have now become, I can find an entire lunch taken over by the pros and cons of part B, and which are the elements that we're going to be taking, and who's providing what care, and how do we understand and begin to deal with the potentially the guilt that can sometimes occur when you realize you can no longer care for your family member yourself, and how do you transition into others to provide those services and support. And this entire community, as it ages, is now, we're having those conversations together, and I so appreciate the League and all of you who have come together to help us realize that we're pretty much all in the same boat and need to have the conversations, as well as the topics, as well as for all of us in the room who are employers and recognizing the extraordinary challenges that we're beginning to face as our workforce is aging as well, and what that means. And I don't know who might be able to answer this, but perhaps, Sara, I'll start with you, whoever might know. Please address, if possible, whole body donation. Can we do it? Where do we do it? Up, down, and what's information about that?
I am certainly not the expert on that. I would say that this beauty of our partnership is that we're bringing together all kinds of resources like that, and in doing that, and in creating this hub of resources, we're bringing together all the experts across our community to answer questions like that. So I would direct you to our website and all of our experts within our partnership to answer that question. Either of you, Mindy?
PCOA's helpline gets questions like that a lot. So please feel free to call our helpline specialist, 790-7262, and they will look through all of our resources and get you where you need to go.
I might just ask, I know we have people in the room from hospitals and other organizations. Is there anyone who would like to offer an answer to that or a suggestion? Or yes, ma'am. Sure.
Yeah, right.
The answer is the University of Arizona Medical School.
And
is another.
So my mom wanted to donate her body, and we actually had to fill out an application.
Okay.
And they may or may not accept it.
So good.
So.
My whole life now. Okay. Thank you. But good. Lots of wonderful opportunities. We'll move through that. Thank you. This one is directed to Dr. Fain. How can a poor elder pay for a home companion? And is there any way to pay for the companion or to pay for a CNA level caregiver? And also, just as you're answering that too, what is the name of the Arizona Grant Organization to train caregivers?
Okay.
Well, we'll go back to the first, because I think
The first one, I mean, that goes right at the heart of the struggles that we have as we're talking about, staying at home. The desire everybody has is most people have is to stay at home and to die at home. And again, the work of the coalition is really outstanding. There's that interface, those 3 to 5 years towards the end of life, that people really become in many ways disabled. They have some problems getting around, and that's a gap in our health care. And I think, Jan, you said, when we can no longer take care of, and my goal is really to make sure that phrase doesn't happen. And so it takes a village to help care for or remain at home. And yes, there's hiring CNA or things like that. We can talk. I'll get to that. But there's also the need to partner with healthcare providers, so that as people, as loved ones who are home may get a worsening of a heart failure or something like that, that would normally push somebody to emergency room, hospitalization, more decline. Nursing home, we can stop that cycle. And there are a number of programs that do it, great Medicare Advantage plans that have programs that take care of people as they decline and can bring services in the home. The flexibility of Medicare Advantage plans help with some of that, and I will leave the details of that to the PCOA. But a number of those programs do help bring in resources. Depending, there are intergenerational opportunities where, depending on the home that you're living in, you can have someone live with you, provide that care, and it's shared living. And then there are neighborhoods that share those resources.
PCOA operates a whole home and community-based services system, and we currently provide supports for about 1,100 older adults in Pima County. So for older adults that aren't yet in the place physically or financially where they would qualify for the long-term care system, they can call PCOA and get a screening and an assessment done to see whether they qualify for in-home support. So that would be a caregiver coming into their home to assist with housekeeping, personal care, various grocery shopping, other services that we can do to help them stay in their home as long as possible, as safely as possible. So if you have somebody who's low income, who's in that situation, please call our helpline. We would love to be able to see whether they might qualify for that service.
Mindy, this one may be best for you, but I welcome anyone. We're seeing more and more what's referred to as concierge medical service in our community. How does that impact the situation, or does it, as we deal with Medicare and other services? Okay, I'll go.
Is this being recorded?
No, and secret safe, right? Okay, yeah.
You know, I think the idea of concierge practices, fills a need that the healthcare system, healthcare providers that we're not providing for people. A lot of that has to do with financing. We talk about advocacy and policy. It's unfortunate that people feel the need for concierge services in order to have their person-centered care met. I don't think that's the answer. It's certainly not the answer for everybody. I think it takes our eyes off what's really important, which is disruption of the current payment system and developing a system that really meets the needs of our entire group as we grow all together. So I understand the need, but I'm not a fan.
Okay. The next question is one that actually I'm going to expand our panel for just a moment, and we may need some people to shout out from the back, because the question is there any legislation that we should be watching or weighing in on this year? And I'm guessing people may know, but and would like to speak to that, but I'm not sure if Senator and Representative are still here, and if there are any thoughts from Victoria or Kristen about what we should be watching this year as well. I don't mean to shout out because I know the days are busy and they may have had to leave, or may have something to add. But is there legislation that we need to watch? Okay. Well, and actually, and I'm looking at former Senator Farley may have ideas as well.
So I'll jump in first. I can talk about locally, statewide, and nationally. There's 3 different things I'd like to throw out to keep an eye on. Actually, locally, keep your eye on the age-friendly initiative that's happening. That's going to go in front of, I believe, the City Council in April. There's the city staff and a number of community leaders have been working on an age-friendly plan for Tucson, and I'm curiously following that being adopted and the impacts that might make in our local community. Statewide, Governor Ducey's budget includes an additional $3.5 million to support home and community-based services throughout the state. We have a waiting list for those services that varies anywhere from 1,500 to 2,500 people on the waiting list for people who qualify. So we're hoping that additional funding passes through and can really make a difference in vulnerable adults that need that extra care. Nationally, the Older Americans Act is up for reauthorization in 2019, and that actually provides for all the types of services that the area agencies on aging, such as PCOA, provide to the community, and making sure that that act gets reauthorized and that there's even greater opportunities in that area to meet the rapidly growing need and the number of older adults is an important one to keep an eye on. You can always go to PCOA's website, and we have an advocacy coordinator that keeps that up to date with the legislation that you should be watching.
And also suggested we may always feel free to turn to the League and the League of Women Voters, who have a variety of information on many of these kinds of issues. Steve?
Yeah, well, I'm no longer a state senator. Either governor or senator. The governor doesn't quite work out. I was actually, when I served for 12 years in the legislature, actually a few years ago was the founder, we finally got a senior caucus in the legislature. A bipartisan caucus where members of the House and the Senate of both parties were able to come together and talk about issues. It's been phenomenally successful. It's continuing on in my absence because Senator Heather Carter, Representative Dean Cobb, and Senator D'Alessandro from here are also carrying on with that topic. I strongly encourage you to get involved in that. I know there are many members of that caucus who come up from the community who meet every month and talk about different legal issues. And a lot of legislation has come out of that. Regarding active legislation, I think probably the most important thing this year will be part of the budget process, making sure that caregivers are paid a livable wage, because that's been a major problem with all caregivers of not just people who are seniors, but also developmentally disabled, in which they have not been, the reimbursement rates from the state have not kept up with the actual cost of providing that care. It's becoming harder and harder to find people to provide that care, and that has a huge impact, a negative impact, and you can't find ways of getting people paid for the tough work they're doing every day.
Thank you.
Put pressure on during the budget session for that.
Budget, always important. Thank you so much. Good.
I want to talk about a win that happened last week. Some legislation that passed Senate committee here in Arizona to move the Advanced Directives Registry. There is a registry that's been housed in the Office of the Secretary of State. And it has been legislation proposed to move that registry from the Office of the Secretary of State to Health Current, which is our health information exchange. And that would allow healthcare providers to access advanced directives, which didn't happen in the past. So we're waiting to see what happens next.
Thank you. Thank you very much. To anyone on the panel, as the population ages, are there more gerontologists locally and nationwide? You're laughing, so I'm thinking I know the answer to that. And at what age should we begin to seek one?
I think it's clear that people are not choosing geriatrics, that's the medical field of caring for older adults, less and less and less. And in terms of nurses, even the nurse practitioner programs in town have really pretty much eliminated the geriatric nurse practitioner program. If you look at other schooling, it's just pretty absent. So we're part of that when we're talking about advocacy, some of it has to do with the salaries of geriatricians, and believe me, I'm grateful for the salary that I get and that our physicians get. So this is not a clear, but when you think about a pipeline, when you have people choosing careers, as a board certified geriatrician, I have the pleasure of making less because I'm board certified in geriatrics. So that just gives you a broad view, and I see some people nodding heads. So again, I think it's just a matter of incentivizing with loan forgiveness or whatever it needs to take to get more geriatricians. Meanwhile, and I'll be quick with this, our Center on Aging has been very involved in training all health providers in the care of older adults in order to make sure that we love geriatricians, but the answer isn't making 35,000 geriatricians, which is the estimate of what we need. It's making sure all health providers have those principles of care. Who needs a geriatrician? If there were 35,000 geriatricians, I would have a different answer, because we're specialists in aging well, and so we can take very healthy 65-year-olds and bring them, to 115. But the answer is usually people who are a little sicker, a little frailer, a little more in need, a little at risk, be it falls or thinking issues or things like that, we have to be selective, unfortunately.
Thank you. Lisa, I'm going to turn to you for this one, and it's sad, but something we need to really recognize. Is there some place in the community we can contact if we feel a senior in our community or someone with whom we're aware is being abused or neglected?
So, two different things. One, if you call PCOA's helpline, we have a team of elder rights and benefits specialists that can communicate with folks that feel like maybe they've been taken advantage of in a business transaction or from a landlord in a rental situation. And so our team works with folks like that all the time. But the primary answer would be, don't forget about adult protective services. There's a great adult protective services unit. There's a central intake unit where you call and explain what's happening. And if that's something they're able to take as a report, then investigators can go out and actually investigate what's happening to see whether there's some exploitation or abuse that needs to be stopped, and whether there's someone that needs to be prosecuted for that. And then they actually coordinate with organizations like PCOA to wrap services around that person to be able to help them be able to not be as vulnerable going forward.
Attorney General Passport. If I could add to that, the Center on Aging, we have a very robust website that has a number of educational sheets for elder care provider sheets and for health professionals, but care partner sheets go over about 100 topics here, like if I see, what to do about elder abuse and so on. So I'd urge you to go to that website and check those out. They're in English and in Spanish.
And I'm going to take advantage of that answer to ask another question that's come in, which is looking for suggestions of how we help some of our community who might not be internet literate or computer literate access these services, because so much of what we've talked about today is referring people into websites. Thoughts, ideas?
I think that's why, again, it's so important to reiterate that PCOA has a helpline, and there are helpline specialists 8:30 to 5 Monday through Friday. That's what they do, and they're not just referring people to websites. They're actually getting people the information they need, giving them phone numbers, mailing them information if that's what's required. There's trainings in town that you can only register for via the internet, and they can go to the internet and register people for them. So they'll do everything they can to walk people through the resources they need if they don't have access to a computer or don't know how to use that.
And I would love to add that although we're presenting ourselves as sort of three different things, kind of, the Center on Aging and Pima Council on Aging work extremely closely together. They'll share our printable sheets with, folks as they come in. We're part of the End of Life Care Coalition. A number of associations here. We're really interconnected. We could be sitting on each other's laps, I think, if we all wanted to. But I just, as we're talking about programs, I just want to demonstrate that interconnectedness.
And I'll put in a plug for my day job. Never hesitate to call the public library, the Pima County Public Library, because they can connect you to any variety of services as well. Thank you. Sara, let me turn to you for a moment, because you addressed, I think, the issue how fortunate you were to have a family who discussed and prepared as a group for end-of-life issues. And I come out of one of those families as well, where we knew everyone's wishes going through things. It is not a comfortable environment necessarily for some people to pull out the administrative, those directives and to have that conversation together. Is there any way you can help suggest perhaps how people might introduce those conversations or help lead them?
Yeah, there are some really wonderful resources available now for starting a conversation. There's a national organization that was started by the writer Ellen Goodman. It's called the Conversation Project, and there are tools available for free via the Conversation Project to help you start the conversation. There's also some really funny videos that relate to starting the conversation and choosing a healthcare proxy, choosing someone who will speak to you when you can't speak for yourself. And my healthcare proxy is actually in this room right now. So it's probably the most important thing you can do is to find someone you trust and talk to them about what you would like most.
So if you're not sure how to start that conversation or even how to begin to make those decisions and you'd like more information about that, there are community workshops that we do as a partnership that you can attend, and there are some of the organizations of the partnership actually have staff that can meet one-on-one with individuals and families. I know PCOA, Interfaith Community Services, TMC for Seniors have specialists that can sit down with you, that can sit down with your family, and just even help you have that conversation, that can sit down with you one-on-one to walk you through all the different types of decisions, the types of things you might need to be thinking about. Because what we've learned is that this isn't a one-time and done conversation. That oftentimes, in order for you to understand and be able to think through it and make the decisions, you need to have 3, 4, 5, 6 conversations. Whether that's with our staff or with your family members. And those conversations aren't just one-time conversations even at that point. They're things that need to be revisited. Maybe once a year, talk about that with your family and see if anything's changed.
Thank you, Lisa. I want to just give a few more details about that. We do have part of the role of our partnership is to offer these workshops as part of our community education pillar. And they're really phenomenal. They're really helpful. And we're also looking for champions. We do train the trainer sessions as well. So if you come to one of those, then you yourself can help train other people in having these conversations and completing your advanced directives. There's also, as part of the partnership, Arizona Hospital and Healthcare Association has put together a curriculum for training healthcare providers. It's called Communications in Serious Illness, and it's one of several curricula available in the United States to help providers become more comfortable having that conversation with the people they care for. So those are just amazing resources, and they're getting stronger and stronger every day. And again, we have them right here in Tucson, and we're improving every day. We're looking for people to join us and give us feedback about that so that we can continue on our quest to become a model end-of-life care community.
And Sarah, you may have answered it. If there's anything you'd like to elaborate, one of our questions is, are there associations that can coordinate shared giving, perhaps caregiving in neighborhoods or in communities? Is it the same organizations?
Actually, I think Lisa might be able to answer that.
So the Pima Council on Aging actually supports what's called the Neighbors Care Alliance, which is an alliance of, I'm not even sure how many, 10 to 15 different groups in the community. And these groups are, some of them are nonprofits, some of them are loosely held neighborhood groups, and they have neighbors that are able and willing to volunteer to help other neighbors in their community. And they receive some training and oversight to be able to do that. If you call PCOA's helpline, we can help determine whether there's one of these programs in your neighborhood, and then connect you with them. And there are folks there that can just provide companionship. They can provide transportation and some grocery shopping for people, take them to doctor's appointments. There's a lot of different ways that these informal networks exist in the community. So we can link you with those.
Did you think, Madden?
Well, there's another question.
We could be here a while, I'm thinking.
I guess I just wanted to mention another revolution that's happening, because this isn't an isolated thing. You know, it's really important to provide caregiver support and food and so on, but unless we bring the health system together, we're going to have lots of people that are unable to age at home. And so there's a revolution in terms of home care medicine or house call medicine, which is not, you know, it's enhanced with high touch, high technology that partners with all these community organizations and so on in order to help people live the life that they want to and die in the way that they want to. So it's really a partnership. I wanted to emphasize that.
Well, and there are 3 questions here that are, I think, in many ways interrelated, and I'm going to read each of them and then maybe ask everyone from the panel to chime in. But it deals with the care that we're being provided really by the primary care world and our physicians. The 3 questions are, how do we support or help our PCPs do a better job of discussing end-of-life care with patients? One is, what are some of the beginning steps that we can or should be taken to transition our current medical system to a truly self-directed, person-directed care system? And what changes might need to take place so that we're making the environment of caregiving and focusing on the aging a more desirable profession? So I see them all as profession-related as we look at those together. How do we work with our PCPs to do a better job? How do we train people better? And then how do we help everyone become comfortable discussing those issues? Mindy?
Can I? Yeah, you want me to go? Thank you, whoever wrote that question, because we're really, hopefully, in a very disruptive time. I think that the training PCPs, primary care providers, deeply involved in that kind of work, and I mentioned before, is to train primary care providers that they understand geriatric principles of care. We train our providers, and I know this is happening across the city, in how to have those conversations. For anybody coming into the little bit of the world that I have control over, everyone, no matter how old they are asked about advanced care directives. So if you're 25 years old and you come into our primary care clinics, you will be asked, because bad things happen to young people. The other thing is it starts the conversation within the family, and it reemphasizes what Lisa was saying, which is this is an ongoing conversation. The conversation changes between a healthy 25-year-old, a middle-aged person with maybe just hypertension as they develop serious illnesses as they age, and then as they're having very serious conversations. So that we map that out thanks to the elder. I'm going to use the wrong term. I know the letters of it, and because of them, we're able to train every medical student in serious conversations and how to have that over a period of 4 years. And so in terms of bringing the health system advocacy, there are different, just encourage, innovative through the CMMI, the Center for Medicare, Medicaid Initiative. They are coming up with some wonderful payment models that allow us to be innovative in the work we do, but to be able to provide value-based care and use funding to bring a handyman to the house, if that's what we need, just as an example.
I just want to add that as part of this incredible grant that we got to create this partnership, that the Conversations in Serious Illness curriculum is available to primary care docs for free. So ASHA, the Arizona Hospital and Healthcare Association, will come and provide that education to physicians in our community. And we've got lots of information about that on our website, or you can call the helpline at PCOA. The other thing, I think there was a question about person-centered care. And I think the good news is that we've been moving toward value-based care, value versus volume-based care in healthcare for quite a few years now. And as I mentioned before, there are entire departments in hospitals now focused on patient-centered care. And hospitals actually get reimbursed or penalized for their patient experience scores. Patients are surveyed now, and hospitals are starting to pay attention. It's a quarter of the piece of the Medicare value-based purchasing pie. And when it first came out, there were actually healthcare providers saying, "What is this patient experience thing?" So we've grown a lot since then. So that's the good news.
One last question. I've saved this really easy one for the end. How can we work on organizing to overcome economic inequality to increase happiness? Okay. This may be part of our audience participation of today's program as well, but that's economic inequality. I think it's certainly not one we're going to. Perhaps I can suggest to the league the next topic as we begin to look at so much of what we've heard today. I think, and you begin going back to the some of the early comments that were made about the indicators and what impacts so much of our ability to age, dealing with home and food and nutrition and interaction with other people, and all of it, of course, assumes some level of economic stability. And then what we've heard is all of those things so significantly impact our happiness and our ability, and how we impact the happiness of those around us as well. So any other final comments, ladies?
That was a perfect question to end, because it so much rests on the inequality and socioeconomic status. So thank you for that.
And I, again, just to thank you to the league and to all of you for being here. I can tell you that getting ready for today helped me just refocus and go back quite personally and look at everything I needed to do. I'm one of those people who did get things in place, and I have my advance directives. Honestly, probably my ex-husband is not the person to be responsible for that. So, good time to update. As they mentioned, go back, check things, keep an eye on them. So I really am very thankful to the league for asking me to be part of this today for many, many reasons, and to all of you for being here today. And now to Brenda, thank you.
So now you've inspired me, because your ex-husband, I looked and it's my father, and that's not the right person now either. I need to update as well. So we want to thank our panelists. Again, can we have a round of applause? Sara, Mindy, Lisa, and Jan, what a fantastic presentation this morning. So if you would like, you can go ahead and step off the stage if you'd like. Thank you so much. And we want to thank all of you and our sponsors. My name is Brenda, and I have the pleasure of serving on the board of directors for the league. And in wrapping up today's presentation, we want to draw your attention. You came in, there's a little bag on your table. Did everyone have that? Did everyone have fun reading the cartoons that were on the bag? We want to thank Floyd, again, our chair of today's Issues and Eggs, who worked tirelessly to find those fun cartoons. We want to invite you to join the League of Women Voters. I was at this breakfast 3 years ago, and was myself saying, what can I do more in my community to keep learning and advocating? And we're inviting you today to renew your membership as a League member, to join us as a League member, and or to make a contribution to continue the work of the League. As we all know, it's a very, very important time in our country. We're very proud here of the League and what's been accomplished this last year. I was again looking at a report of so many things that happened, and as I look at both the women and the men who are League members, I am in awe of all the hard work that goes on in this community. Last year, there were over 100 presentations that took place, and over 1,000 new people registered to vote, or voter registrations changed. As Lisa mentioned earlier, there's the Running and Winning program, where young students are educated about how to run for office, in particular women. How many of you have been to one of the voter education programs that has been put on? Aren't they fantastic? They are open to the entire community and cover a wide variety of issues. So again, we want to invite you right now to become part of our League. So again, on behalf of the League and the Board of Directors, we want to thank you so much for being part of this year's Issues and Eggs event. And thank you again to our sponsors, and we hope you have a fantastic weekend. And we hope to see you at a future League event soon. Take care.